Hello, this is Dr. Do again. This video is on alphabetic list problems on letter I. Today I'm going to talk about a presentation, a sign, icteric, and the causes. The icteric is a medical term. Actually, the color is for the jaundice, the yellow staining either at the sclera or the skin. There are many causes of this icteric or the jaundice. What are there any emergency situation associated with this jaundice or icteric staining? Yes, especially for the newborn. If the icteric or jaundice immediately after the birth, that is not normal. Usually, the normal we all know the newborns had the skin because of the minor hemolysis. But usually occurred after 2 days. It's not immediately after the newborn. So the newborn, if have the jaundice very shortly after delivery, that is the emergency. So has to be treated right away to be taken care of. Or the icteric associated with hemolysis, acutely hemolysis, drop the blood pressure, heart beat really faster, so that is another emergency indicating the hemolysis for adult or for children, either caused by the allergy, the food, or the blood transfusion, or any other causes. The other emergency situation associated with this icteric is you probably have had this icteric or not without notice, and suddenly developed the vomiting of blood, which is indicative for the hepatic disease with the varicosis along the esophagus, and without treated, without diagnosed. And if that's the case, of course, this is the emergency. So this is the situation I can think of associated with this icteric that really warrant emergency. Or the icteric on top of that, complication with other systemic disease, comorbidities, and this icteric associated with altered mental status, which means the hepatoencephalopathy. So if that's the case, also need to see the emergency. So this is seems very simple, and this icteric skin discoloration could be very subtle. Can you manage at home? There's some occasion I can think is for those with genetic disease I mentioned before, glucose 6-phosphate dehydrogenase deficiency. For those people probably accidentally eating the fava beans or take some medications, and you develop this yellow skin. Probably there's nothing can be done, just stop the medication or stop the offensive food, but still you need to call your physician to make sure nothing serious going on. So basically this icteric disease is not minor, has to be managed by the physician, because this either means the blood or the liver disease associated with this yellow or jaundice or icteric discoloration of the skin. So talk about this discoloration. There is a chemicals cause this icteric or yellow or jaundice. It's called bilirubin. Bilirubin is the product metabolized either through the blood or through the bile. So one way or another, usually, so there are two pathways that can cause this accumulated bilirubin, either from dysfunctional liver disease or from the blood, breakdown of the red blood cells. So whenever for those with or without medical knowledge, if you notice the skin getting yellow, you probably just two things you need to think, either the liver disease or the blood disease. And some of them, like us, or like some other darker skin people, or the light skin people, the icteric, the staining on the skin probably is not easy to tell. The other place to tell this icteric or jaundice is the sclera, the eyes. Usually the sclera is kind of the argent or the blue whitish color. So if that is the best place to tell the jaundice because it's going to become yellow. If that's the case, definitely, even though it's not emergency, you really need to see the physician to examine, to test, to find out where is this bilirubin come from, either from chronic hemolysis or from the chronic liver disease. So that is the major causes. Talk about the causes like liver disease. Any kind of liver disease can cause this bilirubin elevation, and there are different types of bilirubin, either conjugated or free form or direct or indirect. That's really up to the physician or medical professionals to explain. But for the patient, as a patient, as a sense of patient, just know how to identify this and think about what kind of causes. If you're interested, you can definitely search what are the causes for this jaundice. Who are either at the risk of this jaundice, icteric discoloration? Like I said, chronic liver disease, hepatitis, or cirrhosis, or alcoholic, or not alcoholic, just people like to drink alcohol and causing liver damage, either fatty liver or non-alcoholic fatty liver, or this is the group of the cause of elevated bilirubin, and also cause this icteric. The other thought about this icteric or discoloration of the skin are from the blood. The broken of red blood cells, like I said, either from known or unknown genetic disease or not genetic disease. Sometimes, usually if the red blood cells break down, could be by the genetic disease, like I said, either sickle cell or the glucose 6-phosphatidehydrogenase deficiency, or other causes. Or there's some medications can cause this breakdown of the blood cells. So if that's the case, really you need to call your physician. If you have this icteric with other comorbidities, other chronic diseases, and you add a new medication, you develop this discoloration of the skin, definitely very likely caused by this new medication or your previous other chronic disease getting worse. So regardless, if you have this, then you definitely need to call your physician to check it, whether it's from the disease or whether from the medication causing the blood cell breakdown or causing the liver damage. So basically, summary about this put together, it's very fundamental, because this icteric jaundice of the skin is a full realm of workup. Have to check a lot of things, the blood, the liver, image or not image, and has to thorough workup to find out, to identify the cause, unless there's known conditions associated with this. For the new onset of this icteric discoloration of the skin, definitely that worth of the full range of labs and examinations to identify what is the real cause for this. It could be very minor, like I said, medication or some oxidant unmask the genetic disease, or could be a serious disease from the systemic or chronic, just not identified. So anyway, I'm just going to put this video here to just for those who are interested in your health and interested in medical knowledge, and to improve the communication with your professional, with your physicians. So this video serves that purpose, and also for those with chronic disease or taking medications, just pay attention to this discoloration of the skin. It could be serious, it could be really regardless, you need to talk to your physician about the causes and to identify and to treat. So I'm going to stop here, and thank you for watching. I will see you next time.